Hello, my name is Dr. Kathleen Jude Estime, psychiatric nurse practitioner, and today our video is about how sepsis causes septic shock. So you're the nursing student and you want to learn about sepsis. So sepsis is a life-threatening systemic inflammatory response to an infection. So remember infection. You must highlight the fact that it's a critical need for early recognition and rapid intervention. And we're going to go over the detailed explanation of symptoms, risk factors, diagnostic criteria, and priority in nursing intervention, like fluid resuscitation, broad spectrum antibiotics, and close monitoring of the vital signs, while emphasizing the importance of recognizing progression of sepsis shock. While emphasizing the importance of recognizing the progression of septic shock with signs of inadequate tissue perfusion and organ dysfunction. So key points to cover is the definition and the pathology. So septicemia is a severe infection where bacteria enters the bloodstream, triggering a systemic inflammatory response that can lead to organ dysfunction. The stages of sepsis is systemic inflammatory response syndrome with SIRS, which is a non-specific symptoms like fever, tachycardia, dyspnea. Systemic inflammatory response syndrome is an inflammatory process where the clinical manifestations like vital sign changes, the potential causes, including infection and non-infectious triggers, early recognition and importance of prompt intervention and supportive care are crucial. Include fluid management and address the underlying cause of the SIRS. It's important to recognize the classic triad of SIRS, which includes fever or hypothermia, tachycardia, tachypnea, elevated white blood cells, decreased urine output, altered mental status, hypotension in severe cases. And the causes of SIRS are infectious causes, which are the most common. Bacterial infection, example, pneumonia, urinary tract infection, fungal infections, viral infections, non-infectious causes like major trauma, severe burns, pancreatitis, extensive surgery, ischemia, reperfusion injury, and progression to shock. Uncontrolled SIRS can lead to systemic hypotension, inadequate tissue perfusion, and ultimately shock. There's a difference between the types of shock that can be associated with SIRS, which the most common is distributive shock. Early recognition and assessment. We want to stress the importance of early recognition of SIRS and performing a thorough patient assessment, including vital sign monitoring, physical exam, and laboratory tests. You also want to discuss with your provider scoring system that can help identify patients at risk. Management of SIRS and septic shock. We want to highlight the need of prompt intervention, including fluid resuscitation with appropriate IV fluids, addressing the underlying cause, example, antibiotics for infection, vasopressor therapy for hypotension, oxygen therapy, monitoring for organ dysfunction. Severe sepsis, SIRS criteria with evidence of organ dysfunction. Septic shock is severe sepsis with hypotension despite fluid resuscitation. So the monitoring for organ dysfunction, there are two types. So in severe sepsis, your SIRS criteria with evidence of organ dysfunction. With septic shock, severe sepsis with hypotension despite fluid resuscitation requiring vasopressor support. The risk factors are you're going to monitor closely your elderly patients, immunocompromised individuals, chronic diseases like diabetes and COPD, invasive procedures, recent surgeries, indwelling catheters. Clinical manifestations are the early signs are fever or hypothermia, tachycardia, dyspnea, altered mental status, elevated white blood cell count, late signs of septic shock or severe hypotension, decreased urine output, elevated lactic levels, signs of organ dysfunction, altered liver function, respiratory distress. For diagnosis, we're going to look for blood cultures, clinical assessment based on SIRS criteria, and laboratory tests like C-reactive protein. And your nursing management, your early recognition and rapid response emphasize the importance of prompt assessment and early identification of potential sepsis. You're going to want to fluid resuscitation, administer large volumes of IV fluids to maintain adequate blood pressure, antibiotics to promote administration of broad spectrum antibiotics based on specific source of the infection. Monitor closely your vital signs, urine output, and other indicators of organ function. Oxygen therapy, ensure adequate oxygenation. For vasopressor therapy, if fluid resuscitation alone is not sufficient, administer vasopressors to maintain blood pressure. Pain management, address pain appropriately, and infection control measures. Practice strict hand hygiene. It's very important that you practice strict hand hygiene and infection control protocols. This is our video on septicemia and septic shock, and like and share if you learned something. Thank you.